Hi, I'm Dr. Heather Moore, owner of Total Performance Physical Therapy. Tonight we are going to go over how do I sit properly. New year, new you, everybody's Googling how they're going to become healthier in 2018, what they're going to do to kind of ramp up their fitness efforts and, how do I get rid of this back pain, knee pain, whatever. I'm really going to, become ergonomically correct at work. And if you Google this topic, you can buy so many things that make it easy to, make your desk ergonomically correct. But at the end of the day, if you're not going to sit up straight, you're not going to sit up straight. So you can buy all of the tools and the pillows and everything that you want. It really isn't going to make a difference. If you're going to slouch, you're going to organize your desk so you're going to slouch. So what I'm going to show you is how you need to sit up properly without all of the desk accoutrements that you can get. Are there things that you should have? Yes. Do a lot of those things slowly go away over time as you want to slouch and get into more of a comfortable position? Of course. But while I have your attention in January of 2018, and everybody is on this kick to get better, we're going to go through a couple things that you can do to sit properly. Now, what you want to do is when you are thinking about setting up your desk, or when you're thinking about sitting down and you're thinking properly, or thinking about it has been such a long day. When you're thinking about sitting properly, you want to make sure that you don't overcorrect, okay? A lot of times what people do and why they fail or why they are unable to sit correctly is because they overcorrect. And what I mean by overcorrect is, and by the way, your chair should not be on wheels that you sit on. I'm going to sit on a chair with wheels only because it's easier. Chairs with wheels usually don't have as many options. Like this doesn't raise or lower or anything like that. Now, some of the very expensive ergonomically correct chairs do have wheels, so that's fine, but this is not a good example of a chair that you should pick. So a lot of people, when they go to sit up straight, they overcorrect. So they jam their shoulders back and they sit in attention and they try and sit like this all day. And they make it like 5 minutes, which is probably all I could make it when I'm sitting in this position. Shoulders start to burn, you get heavy, you wind up being really uncomfortable. And you wind up being uncomfortable in a position that is also incorrect. It is just as harmful to overcorrect as it is to slouch. So if you're one of those people who is sitting at their desk and they're sitting in their car and they're trying to sit up nice and straight and this is like such a workout, it's because you're going too far in the other direction. And you want to make sure that you're not going too far forward and you're not going too far backward. Either way is incorrect. Either way is going to cause you problems. Either way is going to cause you pain. So when you go to sit properly, there are a few things that you want to make sure that you do. When you're sitting down, okay, you want your feet to be flat on the floor, or what you can do, and what I usually recommend doing, is you want to sit on the edge of your chair. And again, if it's on wheels, this makes it a little bit more difficult. But if you sit on the edge of your chair, you drop one leg back, and you have one leg at 90 degrees. I sit like this constantly. Why? Because what this does is this automatically, this leg being dropped, it pulls your pelvis into the correct position, okay? Now I'm not too far forward, so I'm not arching my back, and it's really actually hard for me to slump, okay, because my leg is dropped down. So it's pulling my pelvis forward. So here I am and I'm sitting like this. Now most pictures online, even ones we have, will show that you're supposed to sit like this. But this is another variation that is okay, all right? Now your feet like this, okay, or your feet up like this is not okay, all right? So you want your knees to be below your hips, all right? If your knees are up like this, you have no choice but to slouch, and then you're going to go into bad posture, okay? The thing to remember about posture is that how your legs and your arms are positioned are going to dictate how your back is. It is impossible to have your arms or your legs in the wrong position and have the ability to sit up straight, all right? So you can't have your knees up here and be like, okay, I'm really going to sit up straight, and I'm going to tell myself I'm going to sit up straight. It's not going to happen. You can't sit up straight if your knees are not in the correct position, if your hips are not in correct position, and if your arms are not in correct position, okay? So when it comes to your legs, quick, easy, you have two options. You're either here with your legs below your knees. Now again, this chair does not adjust, so I got to demonstrate this a little bit wonky, but what you want to do is your knees are below your hips, okay? This should not be an effort. If you feel like, okay, now I have to sit up, then your knees and your hips are not in the correct position. Because what should happen is your knees should naturally pull you into a neutral spine, okay? So I'm not super arched and I'm not slumped over, okay? I'm in a nice neutral spine. That's where you want to be when you're talking about sitting correctly. So for those of you, no matter what chair, some people sit on a ball, this is where this actually comes from. I sit on a stool a lot. Drop that one leg down. It's going to pull your pelvis forward. Again, if you feel like this is work or 5 minutes later you're like, I am exhausted, then you're doing it wrong, okay? This is nothing more than me dropping my leg. Now, some of you, if you have tight quads, muscle up front, it's going to be a little bit uncomfortable because you're going to feel a stretch through there, but this really isn't that big of a movement that you're going to feel a stretch, okay? So this is how your legs should be. How should your arms be? What you want to do is you're going to roll your shoulders up, back, and you're going to drop them down, okay? Now, I must teach this more than any exercise I know. And every day, at least 5 times a day that I teach it, someone goes like this. Okay, that's not the exercise, all right? The exercise is you're going to roll your shoulders up, back, and you're going to drop them down, okay? This is going to put your shoulders exactly where they need to be. All right. Then what you want to do is you want to make your workstation or your steering wheel or whatever it is come to you. If you find that you do this, you roll your shoulders up, back, drop them down, and you bring your hands here, and you wind up and you're like, okay, well, I'm just going to leave my mouse there because I can stay in this position and just move my mouse. There is no negotiation. And this is where you want to start maybe buying something for your desk or buying something for your situation that would make it better. But if you have everything that you need, like you don't need necessarily a special chair. They're great. I'm not saying if you have one, it was a waste of money. They're fantastic. But for those people, departments are cutting back on money. You know, you wind up sitting in some old chair. I had a patient once who had to sit at a picnic table. So yeah, it happens. So this is for, those people who don't have that fancy chair that adjusts 75 different ways. You want to roll your shoulders up, back, and you drop them down. All right? A lot of times when you do this, you're going to find that your shoulders were up here. This is a very natural position for a lot of people to have, and if you have neck pain, back pain, your shoulders are guaranteed up here. All right? So you want to drop them down, let your arms relax. So you roll them up, drop them down, bring your hands up to 90 degrees. Look at where everything is. I'm going to tell you right now, if you have a laptop, you have to get either a separate keyboard or a separate monitor. You cannot have a your desk positioned correctly if you have a laptop and you don't have one of those things separated. Why? Because here's where your hands want to be, okay? So the keyboard should be here. However you have to do that, whether it's a keyboard, and honestly, like if you have a box that you can put it on, it doesn't have to be anything fancy. Like get it here. You don't need separate, we don't need fancy things to pull out. Your monitor should be eye level. Now, I know dualies are a big thing, okay, or however many monitors people have these days. I get it. They all should be eye level, all right? The minute they drop below eye level, and yes, I know, you're going to rationalize in your head. You're just going to drop your eyes a little bit, so you're just going to look down. Give yourself 10 minutes. You're going to look down, your eyes are going to go, and your head's going to go. Your shoulders are going to go. Your eyes will lead your entire body into a slump position, okay? I'm telling you right now, if you do not have your monitors at eye level, right here, you will slump forward. You will not be able to maintain the gaze down look or the gaze over look. It's not going to happen, all right? So really make sure that your monitors are eye level, your keyboard is 90 degrees. However that happens, make it happen. All right? It doesn't need to be anything fancy. Sit-to-stand desks are great, but make sure they are sit-to-stand desks. Make sure you have an option, and a lot of them now are the lever options or whatever. Make sure you have a sit-to-stand desk. The posture is the same whether you're sitting or standing for those shoulders, okay? Up, back, drop them down, 90 degrees, okay? Eyes straight ahead. Steering wheel, whatever it is, all right? If you're slumped over on the couch right now and you're complaining of back pain or you have hip pain, that's why, because you're like this and everything is now bearing down on your discs, all right? So if you have back pain and you're slumped over in the couch or slumped over in some chair, that's part of the problem. Lazy boys are actually really good because you can lay back and they have an entire support system as you lay back, all right? And notice in this chair, like a couch, you'd have to slump down in order to be comfortable. So the main things you want to think about when you are sitting and you're thinking about how you're going to sit correctly is, one, do not overcorrect. Do not jam your shoulders back. Do not sit at attention. It's completely wrong in the opposite direction, all right? Second, you want to make sure your knees are below your hips. That's going to pull your pelvis into a forward position. That's going to allow your pelvis to naturally be where it needs to be. Again, if this feels like work, or you're exhausted, or you're sore, or you're like slumped over because you're like, I can't even do this anymore, you are putting too much muscle into it, all right? Use gravity, use your legs. Let your pelvis naturally come into where it needs to settle. All right, it should not be a conscious thought in order for you to jam your back up, all right? And finally, roll your shoulders up, back, and drop them down. That is how you're supposed to sit, okay? It should not be effort. It should not be burning. It should not feel like you're getting a workout. And it should be fairly easy to maintain. Straight back chairs help somewhat, I guess. I'm just trying to think of all the questions I normally get throughout the day on this topic. But you really want to make sure, this is 90% of the reason people have back pain is because they don't sit correctly. I could cure all the back pain tomorrow, for the most part, if people went and sat correctly for the 8 hours or 10 hours or however long they sit. And if you actually think about it and you actually put on your phone like a timer, you sit for a lot longer than you think. You're actually not up as much as you think you are. You actually are seated. So however long you sit there and you sit there in poor posture, all you're doing is causing yourself issues, all right? And yes, you might be, 50 and never had a back pain issue, and all of a sudden you have it. Your body finally gave out. You might be 25. You might be 15, all right? So really pay attention to these 3 things that I gave you to help you sit properly.